Hello everyone, it's Rick MacDermid here at Senior Solutions Group, and I guess we're popular today because our website has crashed. So there's so many of you online on our website. Those of you who are on YouTube, you can continue to watch. It looks like that's working just fine. As a reminder, we are recording this and we will upload this session at the end of the talk. So shortly thereafter, those of you who can't see it now, which I think all of you who are on YouTube can, will be able to watch it later, or if you really want to watch it again, you can watch it again later on. So we're just going to take a couple more, maybe a minute or two, to make sure we get the people that need to be redirected to our Facebook page can get it on Facebook, since our website has been crashed. So just hang in there. Okay, so thank you for jumping in, by the way, for jumping on today. We really appreciate you taking the time to do this. This is our 6th year of doing this. We started this during COVID the first time. We used to meet at a local hotel. It was the Howard Johnson at that time, every fall. And once COVID hit, we decided to go virtual. And it's worked really well since then, because people can watch it on demand and tell their friends, and your friends can watch it on demand. Little update, our family is growing. Our son Jacob there on the right, he's our oldest, next to our son-in-law Nick, who is our producer today. Thank you, Nick. And our youngest daughter Lizzie is right next to Nick, holding our youngest granddaughter Ivy. We got to watch her this weekend as Nick and Lizzie went to the Seahawk game, and she got to spend the night. So much fun. And of course, myself and my beautiful bride, Tanya. And then next to Tanya is our oldest daughter, Faith, with her husband, Sean. And they are with our oldest daughter, Lauren, our granddaughter, Lauren, and Colin, our grandson, who is staring at his papa, it seems. Loves his papa. And he loves tractors, by the way. Can't get enough of tractors. Here's our amazing team here at Senior Solutions Group. On the right, we have Michelle Kickland. Then we have Christina Galvan. Then we have Destiny Green. Of course, Tanya and myself. My sister Tammy and Robin Huck. Robin's our newest member, and she is an amazing person. She will greet you at the front door and answer the phones, and just a wonderful, wonderful asset to our team. Also got the opportunity to go back to DC once again earlier this year with NABIP, the National Association of Benefit and Insurance Professionals. We actually got a tour of the White House on the second day it was open for tours, and had a wonderful time there. I went with my brother-in-law Chuck, who is Tammy's husband, and we actually got to spend some time cohorting with about 600 different Medicare and healthcare advisors. Got to hear from some policymakers, and got to speak with our Congressman's office, Dan Newhouse, about some of our concerns for people on Medicare, how to protect Medicare, how to keep us from being lumped in with the telemarketers, and to really advocate for you. That's why we do this, and we did this on our own dime, by the way. So we actually pay to go back there for you. And those of you who were able to check out our Safe Retirement workshops this summer, we had a great turnout for those. We did a number of those, talking about Social Security, safe income strategies, also how to maybe save money on taxes in the future, as well as alternatives to traditional long-term care insurance. We'll be having those again next year for those of you who missed them and would like to attend. And also, don't forget to type in your questions during our discussion. We'll have a question and answer period at the end of our discussion. So what we're going to do today, we're going to talk about what you need to know. Why is there so much change this year? And a lot of it, a big chunk of it, is due to the Inflation Reduction Act that was signed into law 3+ summers ago by President Biden. What you need to do, we're going to break it down by categories as well. Part D standalone prescription drug plans, Medicare Advantage plans, which usually include Part D drug coverage, as well as Medigap, also known as Medicare supplement plans. So the IRA, the Inflation Reduction Act, has had a huge, I can't emphasize enough, a huge impact. It's basically completely redesigned Medicare Part D as we know it, and it's really rewired it. Plans are bracing for 2026 as well as 2027. There's tougher contracting with expensive medications, increased scrutiny by the drug manufacturers and the drug plans. Now, the purpose of the Inflation Reduction Act was to help people, and I believe it will, but a lot of this rewiring is really causing a lot of change, the sea change underneath us as agents. We're feeling it, and we've been preparing for more than just this year, but last year and even the year before. So this is not the end of the change. We're going to see change happening not only today, not only last year, but moving forward in the next couple of years, I believe. One thing we do see that's changing, and we see this every year, so I'm just going to go over this. By the way, those of you who got your Medicare and U-Book, these numbers are not in this booklet. If you go to the online version, they may be updated, but this book was printed this summer, so these are projections. It hasn't been completely finalized yet. We see our Part B premium this year for most people, unless you have a higher income or if you're on Medicaid for low income, it's $185. Now, back in the day when Medicare was brand new, it was $2 a month. So it's gone up since then, obviously. When I first started, actually the Part B premium was about $50 when I first started. So it's $185. And then the 2026 cost is projected to go to $206.50. That's a 11.5 or 11.6% increase. Now, there is going to be a cost of living adjustment pay raise for people on Social Security. Most of you will have this come out of your Social Security check. For those of you who are on Medicare and not drawing Social Security yet, they will bill you 3 months at a time, or you can set up a payment plan online. Our Part D, D stands for drug, prescription drug plan. The base beneficiary premium is $36.78. This year it's going up 6% to $38.99. Now that is not your premium that you pay your insurance company. That is the base premium that the government bases extra help for low-income people to get help with their prescription drug plan premiums, as well as their prescription drug refills. So you can get those at a lower cost based on your income. So if you're wondering about that, never heard of that, you can actually Google apply for Part D extra help online, and it takes about 5 minutes to go, maybe 10 minutes to go through the application. We've helped countless people apply online. It's pretty simple to do so. The Part B deductible. Now that's different from the premium. The premium you pay each month. The Part B deductible is what you pay one time per year when you go to a doctor or maybe you visit the ER. Now when you go to the doctor, let's say it's a specialist, maybe it's a heart doctor. In 2025, you would pay the initial $257. Then if you're on original regular Medicare, not Medicare Advantage, if you're on regular Medicare, you would pay that initial deductible once a year. Then after that, Medicare will pay 80% of what they approve of the bill. Now, moving forward, that's going to go up 12% next year. They're projecting it to be $288. So we're seeing a trend of higher out-of-pocket cost across the board, not only with Medicare itself, but with supplemental plans, higher utilization, people delaying care before they go on Medicare. We're seeing increased cost across the board. The Part D deductible, which has to be met once a year, particularly if you're on expensive drugs such as Eliquis, Xarelto, Januvia, those high-end designer drugs. Typically, you would have to pay the deductible on most of the plans, unless you're on a high premium plan that may be maybe $100 or so a month. They may waive that deductible. Next year, it's going up 4.2% from $590 to $615 once a year. So if you're on Eliquis and you're on a plan that has a deductible of $615, you would have to pay that. It might take you 2 or 3 months to hit that deductible next year instead of 1 month, and I'll explain why in a few minutes. Now, part of the Inflation Reduction Act, which was designed to help people, is the catastrophic threshold. This year in 2025, the most you're going to pay out of your pocket when you go to the pharmacy is $2,000 if your drugs are covered by the plan. So if you're on a drug that is a new drug that's not covered by any plan yet, it would not be part of this $2,000 limit. So if your drug is on the list, it's covered, that's the maximum out of pocket you would pay. Even if you're on 10 different drugs that are each $300 a month, that's the most you would pay out of pocket for the entire year. Next year, it's going up $100, 5%, from $2,000 up to $2,100. So this is kind of a bird's eye view of our Medicare landscape. One thing I do want to address real briefly is the part of the big, beautiful bill that was signed by President Trump on July 4th. In that bill, they were not able to get the Social Security, no tax on Social Security through. Too big of a bite to try to chew off. But what they did instead is there is a senior bonus deduction. Some of you may have heard of this, some of you may not. Most of you are 65 or older. For those of you 65 or older, there is a $6,000 per person, if you're married, deduction effective for 25 through 2028, so it's temporary. And if you have a higher income, your modified adjusted gross income is above $75,000 for individuals and $150,000 for couples filing jointly, then it would be phased out for people with higher incomes. But if your income is below that, you could each deduct $6,000 on what you pay for your taxes. And it doesn't even matter. You don't even have to itemize your taxes. It's an automatic deduction. So for some of these higher costs that we're seeing, you may be able to get it back on your taxes. So that's a little bit of good news for those of you. Okay. Those of you who are on a Medicare Part D drug plan or on a Medicare Advantage plan, you would have gotten one of these in September, no later than the end of September. It's called an ANOC letter, which stands for Annual Notice of Change. And this is a sample letter. So this letter basically says you have from October 15th through December 7th to make changes to your Medicare coverage for next year. So that's coming up next week on Wednesday. So if you don't make a change by December 7th, you'll stay in your plan. Now this is important because in this packet, it's a letter, but it's actually a booklet. It talks about all the different changes to your plan, your co-pays, your out-of-pocket costs, and everything that's included in your plan. If there's any changes, you're going to want to review your changes. A lot of you that were on like the United Healthcare Plan 12, the PPO plan, you're seeing a lot of changes as PPO plans are being phased out systematically across the country as they are not cost effective for insurance companies because you can go out of network. They can't contain these costs with the increased scrutiny by the government. The government's really making these insurance companies account for these dollars. And getting back to the Inflation Reduction Act, we're going to talk about that more so in this discussion. So when we look at these letters, we just want to make sure that your plan doesn't have any major changes. But we also want to talk about network changes. We're going to talk about MultiCare here locally, here in our area in Yakima, as well as statewide. So getting back to the Medicare Part D drug plans. So those of you who are on a Medicare Part D drug plan, you would have regular Medicare A and or B. Most people would have both A and B. And then you would have a standalone prescription drug plan. And the vast majority of you will also have what's called a Medigap, also known as Medicare Supplement Insurance. So think of Medicare as the truck that pulls the trailer. Here's the trailer right here, kind of connected by a trailer hitch to the truck. So wherever the truck goes, the trailer follows right along with it. So you have a Medicare supplement plan, and the Medicare supplement plan does not cover prescriptions. Therefore, you have to have what's called a standalone Medicare Part D drug plan. And we're seeing these Inflation Reduction Act provisions really hit these drug plans where it hurts. One of the big changes that we've seen moving forward with these drug plans is now that they're being forced to cover 100% of your drugs once you hit your $2,100 maximum next year, $2,000 this year. After you hit your deductible, which some of you may not even hit your deductible next year if you're on inexpensive drugs. So you would be responsible for the first $615 of your Eliquis or your Xarelto or your Januvia. And then once you hit a $2,100 maximum out of your pocket, then you get catastrophic coverage and you pay zero for the rest of the calendar year. How is that going to really play out? So if we go back to the previous rules, back in 2023, before the Inflation Reduction Act kicked in, you had a catastrophic coverage. See, this blue part here is your Part D plan. The yellow is what you would pay. The green is what the manufacturers of the drug would pay and what Medicare would pay. So during this coverage gap, also known as the donut hole, you would have to pay a portion of that out of your pocket. And then once you hit a catastrophic limit, you'd pay 5%. Medicare would pay 80%. So when you're on these really expensive drugs, back in 2023, the insurance companies were only paying 15% of the cost, where the government was paying 80%. Fast forward to 2025, look what's happened. The insurance companies have gone from paying 15% of the bill to 60% of the bill on these ginormously expensive drugs. And then 20% is covered by the manufacturers, and Medicare, CMS, is instead of paying 80%, they're only paying 20%. So the script is completely flipped. And most people that are on a Medicare Advantage plan, this has affected your plan as well. Someone's going to pay for this. Where is this going to come from? We're going to discuss that as well. So on your prescription drug plan, you might see, if you're on Cigna, your premium going up from $0 to $50. Those of you who are on WellCare, you might see, oh, I have another year of a zero premium plan. That might work really good for you. I would still advise you to take the time. Those of you do-it-yourselfers, you can go to medicare.gov. That's the official government website. By the way, we're seeing a number of agents, since we're no longer compensated, for the most part, we're not compensated by the plans anymore, because they're on the hook for a lot of money, a lot more than they've ever been on the hook for. Their risk is 3 or 4 times higher what it used to be. So for the most part, they've cut us out of the equation. Now, we weren't making much money at all on these drug plans. We've done it as a service. We're going to continue to do it as a service. But what we would ask, if those of you who would be willing to give medicare.gov a try, you can actually do some shopping on your end if you'd like to. Let's put in our zip code at 98902 in Yakima. So on the medicare.gov plan finder, you can make sure you're on the best plan. Now, those of you who don't want to give this a try or don't do computers, which I think all of you do since you're on this talk today. By the way, I haven't asked you yet. Those of you who are on a standalone Part D plan, raise your hand. I know I can't see you. Raise your hand if you're on a standalone Part D drug plan. Okay. Many of you would not be eligible for extra help based on your income, so you would just check, I don't get help from any of these programs. Those of you who know that you do get extra help, you can check this box right here. Okay? But for most of you, you're going to check, I don't get help from any of these programs. Again, we're on medicare.gov. So when we're done today, you can actually go to the website and check it out. Do you want to see your drugs when you compare plans? Yes, we do. We'll hit next. Now let's type in some of the drugs that are now covered under the Inflation Reduction Act. So in 2026, these high-end drugs such as Xarelto will have a lower price point. So there's a handful of drugs. There's 10 drugs that are going to be about the third of the cost of what they've been in previous years. Another one would be Eliquis. Eliquis is going to be about a third of the cost next year because the Inflation Reduction Act has required these 10 drugs be negotiated in price starting next year. So they negotiated the prices in 2024. The new prices will kick in next year in 2026. Let's add in Januvia. Now, you're not going to be on both Eliquis and Xarelto, by the way. They do the same thing, blood thinners. Can't be on both. But for the purpose of our plan finder discussion, we're going to put them in today. Let's add a couple more. Lisinopril, which is a standard blood pressure medication. And let's put in atorvastatin, which is a very common drug for cholesterol. By the way, insulin's going to be $35 again next year, maybe less, for a 1-month supply. That was started up initially under the Senior Saver Program under the initial Trump administration, and it was expanded under the Biden administration. So we've got a handful of expensive drugs and some inexpensive drugs in here. We're going to say we're done adding our drugs. Then we'll pick some pharmacies. We'll pick mail order. We'll pick Safeway, and we can do up to 5 at a time. Of course, Rite Aid is now defunct, out of business. Speaking of defunct, you're going to see less of those Joe Namath commercials, or you're not going to see any of them anymore. The company, Benefits Technologies, went belly up. They were sued by the federal government for $100 million for deceptive tactics. So no more Joe Namath commercials. Yay, that's really cool. Walgreens. Let's pick a couple more here. We can look at maybe Walmart. Costco, why not? Continue to view our plans. So based on, now this is really cool, by the way. Medicare will sort through all the plans and list the best plan number 1, numero uno. And we're going to be probably helping, this is one of the few plans that actually uses agents. So this Humana Walmart, or Humana Value Plan, it used to be called Humana Walmart. Now it's called the Humana Value Plan because you can go to multiple pharmacies across the country and here locally. So your monthly premium would be $22.10 a month. Your actual cost for your medicine will be $1,790 through the mail order. And then at a retail pharmacy, it would be a little over $2,000 because you do have a monthly premium. So that's factored into this as well. Then we have the WellCare value script. So you can actually compare these plans side by side. You'll notice that the further down, there's a number of zero premium plans. HealthSpring has, now HealthSpring took over Cigna. They bought Cigna out. So if those of you who are on the Cigna drug plan, you'll see HealthSpring on your plan information. So we have 1, 2, 3, there's actually 4 zero premium drug plans. Here's the Cigna plan that went from 0 to 50. And then we have United Healthcare. So all of these plans don't use us as agents. So we're asking those of you who would like to do this on Medicare's website. We're going to have a tremendous workload helping people who just can't get online, and those are older clients. We really need to have the time and the resources to help those people. We're here for all of you. A lot of our drug plan reviews will be over the phone this year. So if you want us to review your plan, the easiest way is just to contact us, let us know. We will send you a link to your email address where you can upload your prescriptions, put in your pharmacies, and then we'll get you in our queue. We'll get you on our list, and then give us a week or 2 or 3 to get back to you. We ask for your patience, and please, please, please be nice to our staff. There's a number of agents that are no longer doing this service because we don't get paid for this anymore for the most part. So some agents across the country have orphaned their own clients. We're never going to do that. We're going to push through this. So you can see some of the plans have a higher premium. They may eliminate the deductible. See how the deductible's gone on this Humana Premier plan? It's $108 a month. Most of the plans, SilverScript, which is Aetna, has one for $85 a month. More people are going to be on these higher cost plans that have a higher premium. That we've seen this in years past, but moving forward with the $2,100 maximum out of pocket, I predict we're going to see more people gravitate toward either the zero premium drug plans, or we're finding this Humana plan for $22 a month, which we can offer you. One of the few we can offer. For $22 a month comes out on top of with a lot of our drug plan searches. Okay, so that's the medicare.gov website. So we're going to shift gears now. Now we're going to talk about Medicare Advantage. Raise your hand if you're on Medicare Advantage. I'm looking. Raise your hands really high. Okay. Those of you who are on Medicare Advantage, you don't use your Medicare card. Instead, you use your insurance card. So in this scenario, think of the truck that pulls the trailer. The insurance company gets the keys of the truck from the government, and the government pays the insurance company a monthly reimbursement or a subsidy. And then the insurance company's on the hook for your hospital bills, your doctor bills, and you're going to have co-pays for specialists, for hospitals. We're seeing on the PPO plans, the ones that are remaining across the country, higher out-of-pocket costs. Okay, so usually they include prescription drug costs, which is also affected by the Inflation Reduction Act. So we're seeing a lot of these plans having to make decisions if they're on the hook for 60% of these high-end drugs, where before they were on the hook for a lot less. They're shaving away around the edges some of the extra benefits, over-the-counter benefits, dental benefits. Some of these extra perks are, if not going by the wayside, they're being reduced because they're focused on the essential core aspects of your plan. Hospital coverage, doctor coverage, really trying to shift the market to an HMO model where the insurance companies can control costs, not only for them, but also for you. because on a PPO plan, you do have to pay more out of pocket if you go out of network. So with Medicare Advantage plans, we're seeing a lot less of these perks moving forward. Remember 2 years ago when Aetna came out with the national park reimbursement or the state park reimbursement? You could get your entry fee reimbursed, or they would pay for your gym shoes or your workout equipment up to $1,500. All this over-the-counter benefit. Well, because of the Inflation Reduction Act and increased utilization of the plan itself, more people are delaying care until they go on Medicare. We're still seeing some of the residual effects of the pandemic where people delayed surgery. Costs have got to be contained. They've got to right this ship. And I know you don't like changing your plan. We don't like having you to have to change your plan every year. This is not something we're doing for fun. But we have to make sure that you're on a plan that's going to work for you, that's going to cover the essential items, your hospitals, your doctors. So moving into this HMO versus the PPO Medicare model, we were finding out earlier this year that the PPOs were going to go away all across the country. About 1 million people across the country are losing their plans. Now, in our area, I know WellCare is discontinuing a couple of their PPO plans. Regents has raised their premium on their PPO plans. United Healthcare is reducing benefits and raising copays, trying to shift to the HMO model. They feel it's a better choice because of lower out-of-pocket costs when you go to the doctor, when you go to the hospital. Your care is coordinated by your primary care doctor, and they will automatically approve your referral. You need to get a referral to see a specialist on an HMO. So in theory, the PPO was really attractive because you could go out of network, but in reality, we're finding more and more providers are not accepting PPO plans. Actually, there's a shortage of providers. We found this to be the case, especially here locally. One of the areas was physical therapy, for example. We got to address this. We worked really hard with, for example, United Healthcare and other carriers because we're finding physical therapists are not accepting all of these plans. And there is a shortage of physical therapists. So I actually went to Olympia 2 weeks and had a discussion with the insurance commissioner. I'm on the committee. I'm on the agent advisory board for the Department of Insurance in Olympia. I go back twice a year and have this very discussion. I've made our voice heard. I've made your voices heard. I've been in discussion with United Healthcare throughout the year. They're working on it. We do have some providers here locally, but some of you who live in the Lower Valley might decide to go to Prosser, or maybe even who live in Yakima might go to Prosser or might go to Ellensburg until this gets ironed out. So we are aware of it. We're working on it. It's a nationwide issue, but it's definitely an issue here locally. So one of the things we did find out about a week and a half or two ago, for sure, we knew this might be the case, is MultiCare. MultiCare is no longer going to accept Medicare PPO plans in 2026. So this is right off of their website, off the MultiCare website. And we had heard from the carriers that we work with that this was going to happen, and sure enough, it is happening. So this is kind of the bomb that dropped in our lap a week and a half ago. And we sent out letters to those of you who are on the United Healthcare plan. You're going to have some meetings at the convention center to discuss these changes. So you would have gotten letters in the mail. Now I'm specifically talking to those of you who are on the United Healthcare PPO Plan 12, which is a zero premium, and the Plan 16. Those of you who are on those plans, you've got to do everything you can do to make these meetings. Now here's your assigned times right here. Check your letter for further reference. Those of you who are on Regents, not Regents Medicare Supplement plan, so Regents has two separate plans. They have Medicare Supplement plans like Plan N or Plan G, which would be maybe around $200 a month, maybe a little more, maybe a little less if you're married or not, versus the Medicare Advantage plan, which is $66 a month, which also covers your prescription drugs. So those of you who are on Regents, we just sent out letters yesterday. We're going to have meetings at our office. Those of you who are on the Medicare Advantage Patriot plan with United Healthcare that does not include drugs, that plan actually hasn't been affected because it doesn't cover prescription drugs. It's not subjected to the Inflation Reduction Act for the most part. However, the hospital is no longer going to be accepting PPO plans next year. We sent out a letter for you guys as well. Check your mail in the next few days. We will have separate meetings for you. Now, there is more moving parts for those of you who are on the Patriot plan, whether you're on the VA or if you're on TRICARE for life, or if you never signed up for a prescription drug plan, so you enrolled in the Patriot plan just to avoid the late penalty for drug coverage because they do not cover drugs. So we're having a separate meeting for those of you who are on Regents, United Healthcare. Those of you who are on WellCare, not the drug plan, but the Medicare Advantage plan, which includes your doctors, we are going to be reaching out to you as well. I think there's about 5 of you that have the PPO plan. The rest of you, there's a handful of you on the HMO plan. But we're going to be reaching out to you specifically for those of you who are on the PPO plan because, again, the hospital has made the decision. It's unfortunate. It really is unfortunate what MultiCare is doing. That being said, we were going to recommend the HMO anyway, but this gives us, it's more of a clear cut, we need to do this decision. Therefore, the meetings. And the reason we're having the meetings is there's thousands and thousands of people just here locally that are going to be affected by this. We can't meet with 3,000 people or 4,000 people one-on-one. We just can't. Therefore, we're having the meetings. We will have our staff there. We'll be able to help you if you're ready to enroll. We ask that you bring your device. If you can't use your device, we will have our computers there to help you. This is a team effort. This is unprecedented, these changes. I think we're prepared more than we can, more than we've ever been prepared before. And we've been prepared for a long time. I think we're uniquely equipped, having a classroom at our office where we can meet with groups of people. Now, that being said, if you really need a one-on-one meeting with us, either over the phone or even face-to-face, that's why we're having these meetings, to free up slots for people that really do need one-on-one meetings. Here's the deal. On the front end, it may be a little bit uncomfortable for a lot of you, more painful. On the back end, our service, our team is dead set on being available for you. So if you have a claim issue, if you need to review your plan, look up a medication. We're also going to have January, February, March to have what's called the open enrollment window. It's kind of for people that don't get it done by December 7th. I don't recommend you wait till January, February, March, but we have a grace period. We are going to be here for you throughout the entire year. So if we can just get through this season, this October 15th through December season, we're all going to come out strong in the long run. I know there's going to be some orphans out there. In other words, their agent has deer in the headlights. They don't know what to do. Maybe their agent's brand new. Maybe they called someone over the phone and enrolled. Maybe they used a call center. Not my recommendation. Maybe they went to medicare.gov and they just don't understand their plan. There's going to be a lot of your friends and family out there wondering what to do, and they may not be able to get hold of their agent because their agent's too busy. We're not going to be too busy. Now, we ask for grace because usually we try to get back to you within an hour or two. Give us a little bit of grace during this season, but we're going to get back to you. Okay, let's shift gears. Oh, one more thing before we talk about Medicare supplements. Those of you who are on Medicare Advantage and also have Medicaid, the free food program, the free utility assistance program, the value-based insurance design program is terminating at the end of the year. So all of those people that were getting those extra food benefits, those benefits may end unless you can qualify based on a new program for people who are chronically ill. So if you have heart disease, diabetes, if you have one of the chronically ill conditions that meet the criteria, one of the things we heard from United Healthcare is they said that 90% of their members on the dual plans, the Medicare Advantage plans for people on Medicaid, now this is low-income people, they would be able to remap them to the new program. I don't know if it's true or not, but you may find out that you lose your benefits and have to requalify. Now, if you don't get automatically remapped by your plan, you can contact your plan and you can try to self-qualify filling out their form. Now, in other words, you'd say, I have diabetes, I qualify, please reconsider for those benefits. We're going to get quite a few phone calls from people who have lost their free food, lost their benefits, over-the-counter benefits even. Yeah, these, like I said earlier, the over-the-counter benefits on a lot of plans, United Healthcare, are going away because of the Inflation Reduction Act in large part. Okay, raise your hand if you're on a Medicare supplement plan. And also, if you haven't subscribed yet, please do so. We need to get this information out to people. It's very critical. So please, please, please subscribe to our channel if you haven't done so yet. Okay. Medicare supplement plans. Those of you who are on a Medicare supplement plan, again, have regular Medicare and a supplement which pays when Medicare pays their portion. Okay. You've seen in the last 2 years, maybe 3 years, higher rate increases on these plans. How come? What is going on? We are seeing increased utilization in part due to the back end of COVID-19 where people put off their surgeries, their shoulders, their hips, their knees, their pinkies, whatever it is. We've seen a lot of higher claims. A lot of these plans have loss ratios of over 100%. That means they're losing money. They're in the red. They have to raise the rates in order to pay the claims. And they can't just raise their rates willy-nilly. They have to get approval from the State Department of Insurance, in our case in Olympia. Now, we are licensed in many states. If you have friends that live outside of Washington, we can help them. However, most of our clients are in Washington State. In Washington State, many of you know this, many of you don't, you can change your plan year-round. You don't have to do it by December 7th. So unless your premium is going up December 1st or maybe November 1st, we ask that you give us a little bit of time to get through the prescription drug plan reviews and the Medicare Advantage plan changes and the plan reviews. You can get your plan reviewed December 8th and all of next year. So if you're on a Plan G, you might want to look at Plan N, because Plan G premiums are close to $300 a month in many cases. Plan N, which used to be around $130 a month, maybe $140 a month, $150 a month, $170 a month, now it's creeping over $200 a month. Inflation is happening. Hopefully this big, beautiful bill, that $6,000 tax credit, will help towards that. We also, in the state of Washington, the insurance companies don't like our state because by law, by Washington state rule, you can just change your plan with no health questions. And the insurance company can't do a thing about it. So in Washington state, if you're on a plan that goes from 170 a month up to 220 a month, you can get on the same exact plan for, instead of 220 a month, 200 a month. Or if you're on a plan that's 300 a month, you can get on a plan that's 200 a month in Washington state. Other states, the premium might be 120 a month because they have health questions on their applications. Washington state has no health questions. If you're on a supplement, you can switch to a competitive company to get a better price. So those of you who haven't reviewed your supplement plan in years and years and years and years, or if you're on the old plan F as in Frank, you definitely want to review your plan because prices keep going up and up and up. Plan F is no longer available unless you've been on Medicare prior to 2020. You may want to look at a high deductible plan as well, and you compare that with a hospital indemnity plan. Those of you who are on Medicare Advantage on a supplement, if you want to reduce your coverage to save money, we can look at some options. We can do that throughout the year, but we would definitely want to look at a hospital indemnity plan, which would pay you cash if you're hospitalized. We also have cancer insurance, heart attack insurance, and stroke insurance. Those of you who are on Medicare Advantage plans, that's the option 2 over on the right side. You might want to look at a hospital indemnity plan, which would pay you like Aflac would if you're hospitalized. Now, there are some health questions, but we can talk about that as well to see if that would help you with some of these copays that are going up. We've got a plan. We're not flying by the seat of our pants. We know the costs are going up. We know there's pain. We hear you, and we are here for you. So not only do we hear you, we are here for you. We are for you. We are in your corner. You do have some marching orders. Here are your marching orders. Well, first of all, subscribe to our YouTube channel if you haven't yet. Also, thank you for all of your Google reviews. We really appreciate that. I think we're getting close to 200 5-star reviews. Only give us a 5-star review if you think we've earned it, though. Those Google reviews do help our algorithm online as people are orphaned looking for help. So if you want to review us, you can go to Google and put in Senior Solutions Group and hit review. Your marching orders. Those of you who are on a Medicare prescription drug plan, those are the standalone drug plans, and you want to review, you can call us or email us or use medicare.gov to self-enroll. And so we ask you, those of you who can, go to medicare.gov. Remember, the plans are not using us anymore. They want us to enroll people, but we need to really be smart with our time so we can help people that really do need our help. Those of you who are on the Medicare Advantage plan, join us for your assigned meetings. And if you cannot make your meeting, let us know. Please let us know, and we can talk to you about that. But please do everything you can to make your meeting. Medicare supplement plans, again, we have all year long to review your plan options. So just keep that in mind. And we are here for you. We're going to get through this again. I am so thankful for each and every one of you. Your referrals, your trust, your confidence during this season. We know that this can be stressful, and we're going to do everything we can to make this as painless as possible. There's going to be some give and take. We're going to ask some of you to meet us halfway, somewhere in the middle, so we can get through this season. With that, I want to make sure I didn't forget anything. Let me go through my notes. Oh, the one thing I didn't mention is the you know how you can reduce your power bill in 12 equal installments instead of paying all of it during the cold months of the year? The prescription drug plan is part of the Inflation Reduction Act. If you're concerned about your deductible hitting you all at once in January and having to pay $2,000 out of pocket all at once to your pharmacy, you can call your prescription plan and enroll in their payment program, which spreads it out equally over 12 months throughout the calendar year. We can't enroll you in that. This is year 2. Last year we said you might want to hold off. Next year, if you know you're going to be on expensive meds, contact your insurance company. You can walk out of your pharmacy without paying them a nickel. And then you get a separate bill from your insurance company, no more than $175 a month. So that's $2,100 divided by 12 months. So that's going to continue on. Oh, one other thing, the prior authorizations for regular Medicare. Washington State is one of the 6 test states for a certain small subset of procedures. We are hearing that the funding may be in jeopardy for that program. They're trying to rein in fraud, waste, and abuse under regular Medicare, not just with Medicare Advantage. So they're testing it in 6 states, Washington being one of them. So just a heads up there. We may be hearing more of this in the future. Is there anything else? Okay, you got your marching orders. And we're going to move over to some questions here, and they're actually written down. Andy, oh, if you have questions, just type them in. Gabe Lyons, Humana. Yeah, Humana is going to continue to use us as agents for their prescription drug plan. So that $22 drug plan is going to be real popular this year. It's going to have a bigger formulary. In other words, a formulary is what drugs are covered by the plan. It's going to have a larger list of drugs than the zero premium drug plan. So that's a good kind of middle of the road plan for a lot of people that don't want to pay $50 a month for their drug plan. So if you're on the Cigna plan that was went from 0 to 50, you might want to find, okay, this $22 plan could work really good for us. And if something changes with our health, that plan might be a little bit better than the zero premium plans moving forward. So we do work with Humana. They are still compensating us. And we're still licensed to offer those plans. Make sure you call us, though, if Humana does come up as the best plan if you're doing a medicare.gov search, because we are not going to be your agent. So we can't call the plan on your behalf if you have an issue or if you hit a speed bump unless we're your agent of record. Rick Foreman, what if your PCP or your primary doctor or specialist is not part of MultiCare? Give us a call if that's the case. Our main concern, or one of our big concerns, is if you would need MultiCare Hospital, not only here in Yakima, but also in Tacoma and in Spokane. They're all MultiCare hospitals, so that's a big concern. Again, we really want you to come to that meeting at the convention center as well, if you could make those meetings. Okay. And yeah, thank you, Niall. We really want this to be an informative, educational session for everyone. Thank you, Margie, for tuning in. Thank you, Chris. Yeah, Tim Shorley. How about those of us who get their care through the VA? So if you're on the VA, you can obviously use the VA as your primary and use Medicare to back up the VA. A number of our clients have VA and supplemental plans just as a backup because you sleep better at night knowing that you have more options than only the VA. Those of you who are on the VA may want to consider a high deductible supplement plan. If you don't use MultiCare, or if you only use it as an emergency, you could remain on that Patriot plan because it does give you money back on your Social Security check. I know the United Healthcare Patriot plan is going to be a $100 rebate on your Social Security check next year. So again, that plan does not cover prescription drugs. So that's only for people that don't want a drug plan. Okay, we appreciate you too, Gabe. Hope that answer helped you. Another question, if you're on the Medicare Advantage plan, do you still get the $6,000 tax credit? Yes, you do. Yes, you do. So that senior bonus deduction is part of the big, beautiful bill. Hopefully, for a lot of you that pay income tax on your Social Security or your income, or your required minimum distributions from 401ks or IRAs, could help offset some of those taxes you're paying, which could help pay for the higher Medicare Part B premium, the higher deductible, the higher copays. Speaking of copays, if you're on a Medicare Advantage plan, set aside some money for hospital copays. Reach out to us if you want to look at some extra hospital coverage. It's very inexpensive to get these plans. We do have them. We also have dental plans. Once the dust settles, if you have questions about other topics such as life insurance, long-term care alternatives, safe income strategies, we can talk then. Yeah, so I have the Cigna RX plan. Do I need to change that? So you want to either go to medicare.gov to compare your drugs. If you need our help, we're here for you. So reach out to us. So even if your plan went from 0 to 50, now $50 is the highest they can raise the premium. So a few plans did raise their premium $50, which is the limit. Cigna was one of them on their Saver plan. It may still be the best plan for you though, even though it went up to $50, because I know the copays are looking really good on that one. But again, if you need our help, we are here. We do ask for your patience as we get through this. Well, if I can't make the correct time for the convention center, can I come to a different session? Sure. We ask that you don't abuse it though. So if you really can't make your correct time, you're more than welcome to come to an alternative time. If you have a friend or two, that's fine too. But you, our clients, are our top priority. So you do take precedent over getting new people on board. We want to make sure you guys are at the front of the line. So we can help others that also need our help. Let me. Is a $6,000? Oh, let me go back. Yeah, it's a $6,000 a deduction. It's a deduction, I believe. Good question, Uncle Karsten. My uncle's online. Hey, Uncle Karsten. Okay, Mike Lindell. What time is the convention center? Okay, now you have your assigned times. You got a letter in the mail, but these are the times. Now this is for people on United Healthcare PPO. Again, if you can't make your assigned time, I'll give you the freedom, but please, again, try to make your assigned time if possible. United Healthcare 10, you want to come to this meeting. Or, yeah, United Healthcare 12, 10, and 16. If it's a PPO, you want to come. And if you're on Regents, you want to come to our meeting that you'll be getting an invite to shortly in the mail. We just sent the Regents letters out yesterday. Now, Regents, again, Medicare Advantage for $66 a month. Those are the people I'm talking to, not the supplement plan N's or G's. You're good to go on your plan. Because by law, the hospital has to accept you if you're on regular Medicare. Those of you who want to take a look at a Medicare supplement plan, if, let's say you're on the Medicare Advantage train and you want to maybe look at getting off of it, Just remember, you got to go through health questions to switch over to a supplement. So you may or may not be eligible for a supplement plan. Those of you who are on Medicare supplement plan and you're getting tired of the higher premiums and you want to look at Medicare Advantage, well, instead of paying $200 a month, I'd rather pay $38 a month. You can look at those plans, but you have until December 7th to look at those options. Now's the time to do so. If you have any plan-specific questions or specific to your situation, please contact us. We will return your call ASAP. And reminder, if you don't hear from us right away, or if you don't hear from us that same day, you may have a blocker on your phone. We do have a virtual phone system because Medicare requires we record our calls. So if you don't hear from us, just reach out to us again and we'll figure out a way to contact you. We're working on it with our phone carrier. So I know some of you have not heard from us, and it's because you often have a phone blocker that blocks our phone system. Okay, we're going to thank you all for joining. Oh, and Aunt Karen, thank you for joining as well. Appreciate y'all very, very much. Very, very, very much. Tell your friends to check this session out. It will be uploaded shortly on our website. For those who couldn't watch it because the website crashed, it'll be up in probably an hour, maybe less. Okay, over and out. We'll talk to you very soon.